address this particular issue. The problem is that if a dental school opens today with the freshman class today, it's going to take 4 years for that person to graduate from dental school. And a brand new graduate is not a buyer for most practices. Most buyers out there are associates who have been out of school 3 or 4 or 5 years. Those are the glut of the buyers looking to buy practices right now. So if a dental school opens tomorrow, you've got 4 years of getting to be a dentist and 3 or 4 more years of being an associate. It's going to take 7 or 8 years to get enough dentists out there to be able to offset us baby boomers who are selling our dental practices. So what's happening now? Well, the economy was bad last few years. So what's happened? Dentists are working longer. I was saying, well, my portfolio went down. I wasn't getting my 9.8% like I hoped I would get. I'm going to continue to work for a period of longer, and I'm going to continue to do dentistry because my portfolio had gone down substantially over the last 2 years. Ideally, you can see how much that it's changed in the last 2 years. But as age has changed, sadly, net income has changed. You should have sold your practice about 5 years ago when they were at maximum value. These practices right now are not grossing as much or netting as much because what's happened is that people are losing their insurance, the economy's down, you're just not making the kind of dentistry, dollars in dentistry you did back then. And then on top of it, even collection numbers are down dramatically over the last couple of years. And you can see that, you can't read that in the back, it says that collections used to be at 94.5% in 2006. And right now they're 91-point-something% in 2011. So there's more bad debt out there. People are not paying their bills and are not getting their dentistry done. True or false? The fair market value of all dental practices will be certainly declined with the baby boomers. It's actually true. It's going to be a slow process. This is going to take about 5 to 7 more years. There's going to be a lot of practices coming on the market. I just tell all my dentists, if you're thinking of doing something, please be the first person out of your area. Don't be the last person. Get out while the getting's good. Get some kind of transition option in place and make some decisions down the road because you don't want to be the last one out of your territory to sell your dental practice. Next, disability, sickness, and death. Just because your practice is worth $500,000 today, so it needs to be worth $500,000 tomorrow. Practice only has value because you are there to personally produce the bulk of your practice income. Death normally results in a 50% drop in value almost immediately. The remaining value is lost over 6 months. And really what took you an entire lifetime to earn for yourself and your family is lost within about 6 months or less. An estate sale is the most difficult transition you have, especially in small rural practices where there's only 2 or 3 dentists in town. Because what happens is it's hard to attract dentists to these particular areas. And so we've got to get these things sold as quickly as possible. We can't let them sit there because the dentist is gone. So what's that you say? Well, your colleagues will pitch in and help your family to run your dental practice while you're gone. And,